Okay, good afternoon, everyone. So we're going to start by hearing from Dr. Tam and Dr. Njoo, and then we're going to hear from Minister Anand and Minister Bains by video conference. Doctor?
Good afternoon, everyone. Bonjour à toutes et à tous. I'll start with the latest numbers on COVID-19 in Canada. There are now 57,148 confirmed cases, including 3,606 deaths. To date, labs across Canada have tested over 893,000 people for COVID-19, with about 6.5% of these testing positive. Here is the part where we usually move on to a brief update on how we are continuing to slow down the epidemic and what's needed next for us to get down the curve cautiously together. Instead, I want to pause here to reflect on the significance behind our daily numbers that are impossible to fully encapsulate. Each one of the over 57,000 cases has been an illness, striking fear and concern in a person and their family, friends, and community. Each death has been an incalculable tragedy, and to this, that each death has most often meant a goodbye being said with loved ones who are not able to be physically near or to give hugs and comforting touches. It is in these unimaginable tragic conditions that we are most thankful for everyone on the front line of this crisis. Not only do we count on health workers on the front lines to comfort us when we are sick and scared, but they are there too to offer comforting words, human connection, and healing touches. They reach out when we have to remain apart during illness, prolonged hospital stays, and during heart-wrenching last moments. They keep us informed as our loved ones are being cared for, and they share the saddest of news when illness outcomes can bring only tears. Though little can ease the deep pain of loss, there is comfort in knowing how health workers, from those who support and maintain our hospitals and care homes to those who deliver direct patient care, have stepped in and stepped up to allow humanity to shine. From the cleaners who share a quiet word of comfort as they go about their duties, or those who bring by the day's meals, to a whole range of healthcare providers that hold a frightened hand and give reassurance. We can know our loved ones are being provided care with human touch and concern in our stead. As you suffer the loss of a loved one, they weep for you and with you. And all Canadians offer sympathy as you suffer the greatest loss of all during this crisis. Today, I offer these reflections. As I offer these reflections, I'm thanking all Canadians, whether they are helping in our hospitals and long-term care homes, providing essential services, or volunteering in our communities, or continuing to do their very best to stay home to save lives. Because every life matters. So too does our every effort to prevent the spread of COVID-19. Keep it up, Canada. We are stronger together. Thank you.
Thank you, Dr. Tam. We're now going to hear from Dr. Njoo.
Bonjour. Comme d'habitude, je commencerai par faire le point sur le nombre de cas de COVID-19 au Canada. On dénombre actuellement 57 148 cas confirmés de COVID-19, dont 3 606 décès. À ce jour, les laboratoires de partout au pays ont effectué plus de 893 000 analyses et environ 6,5% d'entre elles se sont avérées positives. Habituellement, c'est le moment où nous passons à une brève mise à jour de la manière dont on continue à ralentir l'épidémie et sur ce qu'il faut encore faire ensemble pour aplatir la courbe avec prudence. Mais je voudrais plutôt prendre le temps maintenant de réfléchir à la signification des chiffres quotidiens, des chiffres dont il est impossible de pleinement comprendre le poids. Derrière chacun de ces quelques 57 000 cas se cache une maladie qui a semé la peur et l'inquiétude chez une personne et sa famille, ses amis et sa communauté. Chaque décès a été une tragédie immense. Et plus triste encore de réaliser que ces personnes sont le plus souvent mortes sans avoir pu être réconfortées physiquement par leurs proches sans recevoir de câlins. C'est en pensant à ces situations tragiques, inimaginables, que nous sommes le plus reconnaissants envers tous ceux qui sont en première ligne de cette crise. Non seulement nous pouvons compter sur les travailleurs de la santé en première ligne pour nous réconforter lorsque nous sommes malades et effrayés, mais ils sont aussi là pour nous offrir des mots réconfortants, des contacts humains et des gestes qui guérissent. Ils créent des ponts lorsque nous devons rester séparés pendant la maladie, les séjours prolongés à l'hôpital et lors ces derniers moments déchirants. Ils nous tiennent informés des soins prodigués à nos proches et partagent les nouvelles les plus tristes lorsque l'évolution de la maladie ne peut apporter que des larmes. Bien que peu de choses puissent soulager la douleur profonde causée par la mort de notre cher, il est réconfortant de savoir comment les travailleurs de la santé sont intervenus et se sont mobilisés pour permettre à l'humanité de briller. On parle notamment de ceux qui soutiennent et entretiennent nos hôpitaux, du personnel des établissements de soins ou des gens qui fournissent des soins directs aux patients. En raison des préposés à l'entretien qui glissent tout bas un mot de réconfort pendant qu'ils vaquent à leur occupation ou des mots prononcés par les personnes qui apportent les repas ou encore des divers fournisseurs de soins de santé qui tiennent la main d'un patient effrayé et leur assurent « Nous savons que nos proches reçoivent les soins que nous ne pouvons leur offrir et que ces gens font preuve de compassion et d'humanité. » Si vous perdez un être cher, ils pleurent pour vous et avec vous. Et tous les Canadiens vous offrent leur sympathie car vous éprouvez la plus grande perte de toutes au cœur de cette crise. Aujourd'hui, en proposant ces réflexions, je remercie tous les Canadiens qui apportent leur aide dans les hôpitaux et les établissements de soins de longue durée, qu'ils fournissent des services essentiels et qu'ils fassent des bénévolats dans nos communautés ou encore ils continuent à faire de leur mieux pour rester à la maison afin de sauver des vies. Chaque vie compte et tous les efforts déployés pour prévenir la propagation de la COVID-19 sont louables. Chers Canadiens, ne lâchez pas. Nous sommes plus forts ensemble. Merci.
Merci, Dr. Njoo. On va maintenant entendre la ministre Anand. Ministre Anand.
Thank you so much, Dr. Tam and Dr. Njoo. I echo your appreciation for our frontline healthcare workers. I, too, will begin by extending my heartfelt condolences to them, to people who have lost loved ones, as well as to the families and friends grieving the loss of the 6 members of the Canadian Armed Forces who lost their lives serving our country. As a fellow Nova Scotian, let me say that we are all grieving with you. Today, I will provide an update on our progress this week. Comme dans le reste du monde, une grande partie de nos fournitures continue de venir de l'étranger. Nous faisons toujours face à des défis logistiques en raison de la demande mondiale intense, mais nous constatons des progrès importants. Our airline partners, particularly Air Canada and Cargojet, have helped us bring home 20 plane loads of supplies, with flights coming in nearly every day this past week. We have also engaged UPS to provide additional assistance with moving PPE out of Shanghai. In a competitive environment, our dedicated team on the ground in China ensures that supplies are coming into the warehouse and making their way onto the planes back to Canada. Notre objectif est de mettre de l'équipement sûr, fiable et efficace entre les mains de nos professionnels de la santé et nous prenons toutes les mesures nécessaires pour que cela se produise. Nous demeurons extrêmement vigilants quand on a la qualité des produits que nous distribuons. As we receive testing results, we make needed adjustments to our supplier base so that we are only dealing with companies that can meet the standards that we require. Sur le plan national, des entreprises canadiennes continuent d'augmenter leur production et des livraisons sont encore. This week, Thornhill Medical, based in Toronto, delivered their first shipment of ventilators to the federal government. Our first shipments of face shields began to come in this week, with more than 740,000 received to date, half of which were produced here in Canada by companies like Bauer and Toronto Stamp. I'm happy to report that we have also signed new contracts for 15.5 million face shields from Sterling Industries affiliated with Honda and from HP Canada. As I mentioned last week, we managed to secure a shipment from China of vital chemical components required to produce reagent. This week, I'm happy to announce that we have finalized a new agreement with Luminultra, a leading biotech company in New Brunswick, as the corporation now has the components that it needs to produce enough reagent for 500,000 more tests per week right through to March of next year. Domestic production right here at home. Je suis également heureuse d'annoncer que nous avons maintenant conclu une entente à long terme avec Medicom de Pointe-Claire au Québec pour la fabrication ici au Canada de 20 millions de respirateurs N95 et de 24 millions de masques chirurgicaux par année pour les 10 prochaines années débutant cet été. Cette source d'approvisionnement à long terme pour ces produits essentiels et d'autres fait partie de notre plan, en collaboration avec le ministre Bains, visant à assurer la préparation du Canada maintenant et à l'avenir. De plus, nous avons signé un nouveau contrat avec Logistique Unicor, un fabricant de Saint-Jean-sur-Richelieu, au Québec. Ils nous fournissent plus de 11 millions de blouses médicales. Logistique est l'une des 30 000 entreprises qui ont répondu à notre appel à l'action publié sur notre site achat et vente, où nous avons demandé aux fournisseurs de nous aider dans la lutte contre la COVID-19. We can all take pride in how companies across Canada have stepped up to meet the current challenges that we are facing together. Their ingenuity and tenacity will help us through this crisis. Last week, we launched a running report of our procurements on our website, which was updated on Friday. Les chiffres démontrent que nous avons fait des progrès en passant les commandes et en obtenant des livraisons de fournisseurs au pays et à l'étranger. Mais nous ne pouvons pas ralentir nos efforts. On ne lâche pas. In addition to our immediate procurement demands, we continue to prepare for the possibility of new waves of infections or a sudden resurgence at any given time, which would renew an immediate need for further orders of critical supplies. That is why I have formed a COVID-19 Supply Council, which brings together a diverse group of leaders, from the Canadian Chamber of Commerce to the Red Cross, to provide advice on building innovative and agile supply chains from start to finish. This council is about bringing together diverse industries and experiences in order to best serve Canadians through the next phases of this crisis. The council complements my work with procurement ministers from provinces and territories right across the country. As an example of our collaboration, when we spoke on Friday, my counterpart in Nunavut raised an urgent shortage of swabs. In concert with the Public Health Agency and the Department of National Defense, we were able to ensure that a shipment of swabs was sent on its way to Nunavut within 24 hours. Cooperation has proven to be invaluable time and time again throughout this crisis. Together, we remain vigilant in our efforts to secure the vital supplies that will keep Canadians safe today, tomorrow, and in the months ahead. Thank you so much. Merci beaucoup.
Thank you, Minister. We're now going to hear from the Minister of Innovation, Science and Industry, Navdeep Bains.
Thank you very much, Anita, and thank you very much, Carl. Nearly 6 weeks ago, we called on Canada's industrial community to help meet a critical need for personal protective equipment and health supplies. We also reached out to the wealth of Canadian research institutions, universities, and scientists to mobilize science in the fight against COVID-19. Since then, two things have stood out for me. First, the speed at which Canadian companies and researchers all across the country have stepped up and offered their help in whatever way they can to assist their fellow Canadians in the crisis. And secondly, the diverse and ingenious ways that Canadian innovation has been deployed to address the challenges we're facing. Neither is surprising to me, and I'm incredibly proud of the work being done by our world-class industrial and scientific community. Plus de 6,000 entreprises canadiennes nous ont offert leur expertise et leur capacité. Nous avons aussi mobilisé un grand nombre de chercheurs et des scientifiques qui sont tournés vers la recherche de solutions sans précédent. Today, I'm happy to share the most recent progress coming from these efforts. First, I'm pleased to announce a contribution of more than $175 million to Abcelera Biologics. A Vancouver-based biotech company, Abcelera was the first company in North America to receive a sample from a recovered patient. In just a few short weeks, they've screened 6 million cells and have identified over 500 human antibodies. They are now working on identifying which of those 500 antibodies can not only block the COVID-19 virus, but can be made into a drug to treat the virus. Abcelera is currently working with partners to select antibodies that may lead to therapies that are highly potent, broadly neutralizing, and capable of large-scale manufacturing. Antibodies found during Abcelera's research may also be used to create tests for COVID-19, and the company is working with several global organizations to support the development of new diagnostics to monitor the disease. Human clinical trials are expected to begin in the summer. Over the long run, the company will create the first facility in Canada capable of producing necessary amounts of antibodies, so our country is prepared to respond to future pandemics. Let me turn now to some updates on test kits and face shields. We know that we will need a large number of reliable and accessible tests if we are to reopen the economy safely and responsibly. That's why we just signed letters of intent with 3 companies. As mentioned by Minister Anand, Luminultra, Custom Biologics, and Diagnostics Biochem Canada. These companies were selected through an accelerated process that saw over 100 submissions. Similar to what we did with ventilators, the National Research Council of Canada and a panel of external experts identifies the most promising short-term Canadian manufacturing options for testing. La Supergraph Engine appuie aussi d'autres aspects de la fabrication de protection personnelle. 8 projets ont déjà été approuvés. And most recently, it has contracted 3 new projects focused on medical face shields. These projects are bringing together manufacturing and 3D printing companies, and the resulting partnerships will result in hundreds of thousands of face shields being produced daily by June 1st. Pour conclure, j'aimerais mentionner que la Supergraph Scale Airline mobilise aussi ses membres et a récemment approuvé 8 nouveaux projets utilise la technologie intelligence artificielle pour lutter contre la COVID-19. Innovation is a central part of our mobilization efforts, and by working with Canadian industry and research experts, we continue in our mission of supporting our healthcare workers and ensuring the safety of Canadians as we navigate this pandemic. Together, we will win this fight. Thank you very much. Merci beaucoup.
Thank you, Minister Bains. We are now ready to take questions. As usual, we'll start on the phone with 3 questions, 1 question, 1 follow-up, and then we'll turn to the room. Opérateur?
Thank you. Merci. Please press star 1 at this time if you have a question. Puis s'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question est de l'Inadip de la presse canadienne. À vous la parole.
Oui, bonjour. I'm sorry, I think maybe you have some technical issues. I can hardly hear clearly the ministers. So I'm hoping that Dr. Tam, you can answer my question. What happened exactly with the Spartan cube test? How come it was 3 weeks ago good to go and now it's not?
Yes, so I think it was April the 11th when Health Canada authorized Spartan, the test kit, under an interim order pathway. So this is part of the acceleration of access to innovative testing. But built into that process is actually clinical validation of the device and its system. So it was actually the National Microbiology Laboratory from the Public Health Agency who collaborated with clinical sites in 3 provinces to actually use this device and system to take samples from actual patients. And so while the Spartan system or the device performed very well in a laboratory setting and along the specifications that the manufacturer had provided, it was in the real life setting, in the clinical setting, where it didn't perform well. And right now, it appears that it may be related to the proprietary swab that goes with the system. So I think what Health Canada is doing is to amend the authorized intended use for research use only, so that more clinical validation can be done once the manufacturer adjusts its system. So I actually think this is a really, it really highlights the importance of the kind of quality assurance that we're putting to our new tests, and that really there's been no use of this test kit in a way that would have impacted patient diagnostic outcomes, because you're doing this in the context of an actual clinical trial evaluation.
Okay, I understand. When you talk about the swab, we're talking about the thing that actually gets the sample, I guess. And if not, please correct me. And my question is, on Friday, you were saying that we were testing about 23,000 a day. You were hoping for almost 3 times as much, 60,000. How does this Spartan tube setback impact this objective?
It actually doesn't impact it, because the provincial territorial target collectively of the 60,000 is just on the existing PCR tests within the public health laboratories. And then we would add on top of that any point of care testing that comes on board, some of which are already in use, such as the Gene Expert. That is, for example, also being used in Nunavut, for example. So some of the point of care is in addition to that initial provincial territorial capacity target of 60,000. And I do know that, the provinces are ramping up the testing, and we'll see what happens in the next 7 days as they ramp up some more. I know that in the last 24 hours, we actually did over 31,000 tests.
Merci, Dr. Tam. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. The next question is from Lee Bertium from the Canadian Press. Please go ahead.
Yes, thank you. This question is for Dr. Tam. A number of provinces are going to take the next steps tomorrow, Ontario and Quebec in particular, towards reopening. What will you and other public health officials be watching for, especially in Quebec, where we saw another 1,000 cases reported yesterday? And does the Spartan recall or the issues that have been highlighted there have any impact on what you're seeing in terms of, or what we might expect in terms of long-term or reopening up?
Well, I think both of these provinces have plans in place to escalate the testing. And as I've just said, that the target of 60,000 doesn't actually include any additional of those new tests like point of care. But, this is because we're looking at so many different streams of new tests coming on board. They will have to readjust the timelines of perhaps when they would have expected the Spartan system to be on board. But this is the most prudent course of action, because what you don't want is an actual system out there that isn't picking up the cases as it should. So I think that's actually a really good validation approach. In terms of course, as you've heard from chief medical officers of both of those provinces and across the country, there is no exact right pathway down this slope and into the new realities of living with COVID-19. We all know that it has to be cautious, and we have to actually look at what happens. Some of the criteria that we're looking for is actually published, but it involves, of course, looking at cases coming down. So if you see cases coming back up again, you're going to have to reevaluate what's going on. And of course, one of the critical aspects is your healthcare capacity and your ICU capacity. So making sure that they'll be tracking all of those parameters as they go about these sort of baby steps and cautious path towards this new reality of living with COVID-19. So I think everyone will be watching very carefully as to what happens to the activities. And I know that provinces are also trying to separate out the actual clusters within certain settings like long-term care from what might be actually community transmission. So they'll be trying to look at the epidemiology from that perspective as well.
Follow up?
The number of new cases that were reported in Quebec yesterday. Do you think it's appropriate for this province to move ahead on its plans to reopen?
Well, I think this is up to, of course, the province of Quebec to look at their particular situation. And I also know that, of course, Quebec is a very big province, and it may not be the same even within the actual province itself. So I'm absolutely certain Dr. Arruda and the Quebec public health system will be monitoring this all over different aspects of the province. And they may not do things at the same time for different areas of Quebec as well. But the details are within the purview of the province.
Thank you, Dr. Operator. Next question, please.
Thank you. Merci. La prochaine question est de Philippe Vincent Foisier de Radio-Canada. À vous la parole.
Oui, bonjour. J'aimerais savoir, M. Njoo, Mme Tam, est-ce qu'on a assez de tests de dépistage? Parce que vous parlez de 60 000 qui est la cible. On arrive à peu près à 30 000, mais demain, l'économie dans certaines provinces va rouvrir. Donc, elle rouvre avant qu'on soit capable de faire suffisamment de tests, si je vous comprends bien.
Merci pour la question. C'est Dr. Njoo. Oui, c'est toujours une priorité pour toutes les provinces et territoires d'avoir la capacité pour dépister les personnes dans leur administration. Et la capacité a augmenté beaucoup. Les provinces et territoires sont en train aussi de continuer à augmenter la capacité. Comme on a dit, il y a déjà une bonne capacité à travers le pays pour, comme on dit, le dépistage, le test diagnostic basé, comme on dit, le test moléculaire. Et maintenant, on commence aussi à peut-être introduire les autres outils, comme on dit, peut-être les dépistages, des tests au point de service. Il y a quelque chose qui se passe actuellement avec Spartan et c'est quelque chose à gérer et régler, mais en fin de compte, on a la capacité et c'est vraiment pour les provinces et territoires de peut-être ajuster au fur et à mesure avec aussi peut-être assouplissement de leurs mesures de santé publique. What we're saying is...
Allez-y.
OK. Est-ce que c'est correct? Je répète en anglais ou...
Go.
Okay. What he's saying is, yes, at the present time, certainly the provinces and territories, their capacity for lab testing, which is key, will continue. They've obviously taken steps to increase their lab capacity, and that continues to this day. And certainly within each province and territory, they're making sure that as they maybe begins to relax certain public health measures, that capacity to rapidly detect cases is there. Right now, the capacity is based on what we call the molecular tests, and that's something that will continue to be, in a sense, the gold standard for now. But certainly, provinces and territories, as well as the federal government, we're looking at other types of technology to bring more tools available for testing individuals. And we've just talked about what we call point-of-care testing, including the Spartan test, which obviously at this point needs some adjustments, but certainly we hope to, in the coming days and weeks, make the necessary adjustments, at least accompanied, that will allow it to be used in a clinical sense.
Thank you, Dr. Monsieur Foisy, en suivi.
Oui, j'aimerais juste clarifier parce que je comprends vraiment pas. Là. Est-ce qu'on a suffisamment de capacité pour faire les tests et on n'en fait juste pas assez pour l'instant, ou est-ce que pour l'instant, on n'a pas assez de tests? On en fait 30 000, l'objectif c'est d'en faire 60 000. Donc, soit que c'est moi qui n'ai pas bon en mathématiques, ou soit que c'est moi qui comprends qu'il n'y a pas assez de tests qui sont faits pour ouvrir l'économie, alors que demain, on rouvre l'économie.
OK, c'est Dr. Njoo, peut-être Dr. Tam va peut-être aussi répondre en anglais. Je pense que c'est difficile parce qu'on ne peut pas parler d'un chiffre exact parce que c'est vraiment, c'est vraiment dépendant sur la demande. Parce que si les gens tombent malades, c'est aussi est-ce qu'on a accès à un test diagnostic si on a besoin, si on tombe malade. C'est pas vraiment une question de seulement tester toute la population parce qu'on sait déjà que c'est très important de, comment dire, faire le test pour une personne au bon moment. Si on teste une personne qui est vraiment pas malade, on peut toujours avoir le risque d'avoir, comme dit, un test avec un résultat, comme dit, fausse négatif. Donc, c'est vraiment une question de demande selon qu'est-ce qui se passe actuellement dans la population avec la propagation du virus. C'est une question, on sait maintenant, on a la capacité à travers le pays, mais pour toutes les provinces et territoires, c'est quelque chose qu'il faut vraiment surveiller d'étroite parce que c'est une question, si on commence à assouplir quelques mesures de santé publique, il faut vraiment avoir un système de surveillance aussi de dépistage pour bien détecter rapidement s'il y a peut-être une augmentation des cas déclarés. C'est la question. Ce n'est pas vraiment une question d'un chiffre exact pour une capacité de tests disponibles.
Thank you, Doctor. And I'll turn to the room, starting with Marika Walsh from the Globe and Mail.
Hi, Minister Anand. It's Marika Walsh with the Globe. We're having trouble hearing you, so I'm hoping this will work. I'm just wondering if you can tell me exactly what gap is currently in the supply of PPE that you're hoping this council will fill. What specifically is missing from the complement that this will now help do?
Well, thank you. I hope you can hear me now. Is it any better? The Supply Council isn't meant to fill a particular gap in the supply chain per se, but the goal in establishing the Supply Council is to provide another lens into the point-to-point procurements that we are doing from start to finish, from manufacture to arrival or production in Canada. What is it that we can be doing differently to ensure that we have proper and effective and efficient procurements within our government and across the country? And so the idea is that it is adding to our existing processes by drawing on the expertise of multiple individuals from a diverse set of sectors so that we can ensure that we are thinking about all the necessary things that we need to be thinking about in procurement. So, for example, in terms of distribution, we have much to learn in terms of diverse communities. Should we be adopting alternative and additional processes to ensure that we can reach vulnerable populations. And part of our conversation with the Supply Council will revolve around Canada's incredible diversity and how we can do better in terms of our procurements to ensure that everyone has the supplies that are necessary across this country.
And what are the government's forecasts of how much PPE we will need, either per number in population or per week or a mix of those, when we reopen? How much more PPE will we need once we are all trying to get back to work?
It's definitely true that across the country, wherever you are, people are talking about personal protective equipment and the incredible needs that we are foreseeing. But let me be clear, our first priority as the federal government at the current time is to procure PPE for our frontline healthcare workers. That is what we are doing every single day, and we are procuring from international sources. And as Minister Bains and I have been working on very hard, domestic retooling is also part of that equation, diversifying supply chains. In terms of what is going to be needed for PPE, this is an ongoing conversation that I've been having with my provincial and territorial counterparts, and that we are going to be continuing to have as we go through the next phases of the pandemic. But I will say that from a procurement perspective, we are planning for the short and the long term. We are planning for this phase as well as potential additional surges in the pandemic so that we can be prepared for all eventualities. This is procurement like it's never been done before for that very reason. We need to be planning for the short and the long term and all eventualities.
Thank you, Minister. Ashley?
I'm hoping you can tell me what the impact of the Spartan testing setback is on provinces and territories that have ordered this kind of test kits. You said they've talked about trying to ramp up quickly their testing. Well, what impact does this have?
So I think this is in addition to the targeted around 60,000. So we still, even within that scope, got another halfway to go. If you think about, we're doing 30,000 a day, say, since yesterday, there's still room for them to continue to ramp up the testing approaches. And so then the point of care, actually, the key adjustments and plans will be for, I think, the rural and remote communities. So the concept of using these more near patient tests is so that we can render these communities more independent of transportation. So any kind of delays might, in fact, impact on the fact that we need to continue to transport specimens, for example, that would have been dealt with earlier. But we are looking at other supplies of the point of care. So this isn't the only one. So I think it's, again, a dynamic process. There are, suppliers that are a bit more established, if you like. But when we're looking at innovation space, we know that the pathway of innovation will have some bumps. And I think this is one of those bumps. But it only formed one part of the strategy. So I think we will continue to look for other solutions to fill in those gaps. But I think from my perspective, the impact is more on the maybe timeliness of the return on lab testing for the remote.
Okay. And I'm also hoping to get a sense of, how many provinces and territories ordered these Spartan kits, and, how many are we talking about? Thousands of millions of kits being held back because of the setback?
We may have to get back to you on the numbers because I don't actually have them. I just know that it was 3 provinces that helped with the clinical trial, which we were involved in. And I think there were 5,500 test kits as a sort of part of that distribution. Beyond that, I don't know that there wouldn't be any distribution, but I don't know how much order there would have been.
I could add something there.
That's great. Thank you.
It would be helpful. I think it is important not to refer to what is happening with the Spartan test kits as a recall. This is part of the process of Spartan ramping up to have tests to be utilized. And we We're not expecting that they would be ready at this moment in any case. So in my view, the issues that you're highlighting aren't a recall, aren't defective product at all. The public health lab has said that they will be used in research settings, and Spartan will continue to produce and review and revise the technology that it is producing for the rapid test kits. And then as the testing warrants, they will be able to be used across the country. But again, this is part of the process of producing new technology, of producing something that is going to be very important, but is just getting retooled and ramped up at the current time.
Thank you, Minister Rachel.
Rachel Haynes from CTV. My first question goes to Dr. Tam. The Prime Minister today, when asked about economies reopening, talked about how there's different realities in each province. But we do know that the virus doesn't know any borders, as we've been told many times, and that would apply here in Canada as well. So as the various provinces reopen at different times, are you going to recommend that interprovincial travel remain completely or become completely shut down to make sure that different pockets don't pop up in different areas?
Well, I think we have to continue to share information about what's going on in each jurisdiction. And the interprovincial approach is done by individual provinces, but we know there has to be coordination amongst them. And so, absolutely, I think every province will be watching all the other provinces in terms of where their stance is. For provinces that have very minimal healthcare capacity, they're going to be very careful. Some of the territories are still going to be, of course, looking at the 14-day isolation period for anyone coming inside the territory. And I think some of that will necessarily continue until we've seen what actually happens as people gingerly, cautiously go through the next stage. So absolutely, I think people will be watching the other activities, but the issue of what public health systems might do within the provinces, within their jurisdiction, of course, from a federal perspective, is really about maintaining essential services through interprovincial transport in order to maintain the essential supplies that still has to occur. So that will, again, continue as well.
It's Dr. Maybe I'll just add to that is that certainly the provincial authorities and territorial authorities have the best sort of pulse of what's actually happening in their own jurisdictions. They have the data, they know what's happening on the ground. So the issue of travel, et cetera, is not just between provinces, but even within provinces. As we know, even in the province of Quebec, the hotspot is Montreal, and other parts of the province, the situation might be different. At one point, they even had a restriction in terms of travel within the province. So I think the principle that they're always looking at, including us at the federal level, is about maintaining physical distancing and whatever measures can be brought to bear to try and reinforce that to the point that it's appropriate and necessary within the provincial context. That's what they'll continue to do.
And as a follow-up, as we're talking about businesses reopening and knowing that there needs to be an adequate amount of PPE and masks and other equipment to make sure that we can stop the spread, as part of today's announcement, will equipment be going directly to businesses or directly to healthcare workers where we know that there are still issues in those types of institutions? Will there be some kind of allocation or breakdown of who is getting this PPE?
Well, I think the healthcare system remains a priority. And so that there is an existing mechanism with the province and territories to look at needs and allocation, and that will continue to be very dynamic. And the framework has been worked out. I think one of the most critical aspects of the next stage is to, as the non-urgent health services come back, is for people to actually look at what those requirements are. And I think also that is done through the provincial system. And also, of course, making sure long-term care, because some of those are private entities, some of them are maybe publicly funded, but that system needs to be able to actually provide the necessary PPE. So those coordination discussions are definitely happening at the ministerial level as well as at the deputy minister's level to make sure that health systems can readjust going forwards. And I think in terms of essential services, there's ongoing discussions, but the key is that any business trying to open must align with public health instructions, and you have to sort of look at the plans for how they reopen and have them looked at by the actual public health authorities. And that's the most important thing, because if you've got the sort of specs, if you like, of the 2 meters or physical barriers or engineering criteria, the businesses know their own businesses or how that works the most. So a lot of them are thinking through exactly how that's going to work in their workplace in order for them to look forwards to planning to reopen. So there's a lot of work, I know that, in that space. And there's a lot of guidance being developed for the different sectors within the jurisdictions as well. And so that's really quite active right now. And we might get a little bit more of an idea of, well, under which circumstances are people not able to maintain the 2 meter distance? And then that will give us a better idea of what that supply requirement might look like.
Thank you, Doctor. I think we have time for one more question on the phone, operator.
Thank you. The next question is from Savannah Odd from Brunswick News. Please go ahead.
Hi there. My question is for Minister Bains. Today we've seen an investment in virtual mental health care and primary care. I'm wondering what's being done to improve reliable internet access for rural Canadians so that they aren't left out of this investment.
Thank you very much for that question, and I'm glad you raised this issue. High-speed internet connectivity is no longer a luxury, it's absolutely essential. And our government recognized that we were dealing with this digital divide. We made significant investments in the Connect to Innovate program, which helped 900 communities receive high-speed internet connectivity. We also unveiled in our last budget a universal broadband initiative worth $1.7 billion. And my colleague, Minister Monsef, is responsible for connectivity in that program, and she'll be working very aggressively to move that agenda forward, because we realized before, but more importantly in this current context, the importance of internet connectivity for families, for work, for people to get essential information, and this continues to remain a priority for our government.
Follow up?
Yes, so, and for Minister Anand, as we see some provinces move faster towards recovery, or I guess in later stages where they're starting to reopen, I guess, before some others, will PPE distribution be affected by that? So if a province is, I guess, further along into a recovery phase, does that factor into how PPE is distributed? I know it currently is per capita with some wiggle room based on emergency, but could you just elaborate on whether that's part of it?
Kim, though, to state that the program that the government is doing is based on requests that have come from the provinces and territories for purchases that they require for frontline healthcare workers. And so, as I said, that is the priority at the current time. In terms of PPE that would be generally available when we move through additional phases of this crisis, again, that is an ongoing discussion, and I've had very positive discussions with the provinces and territories around the procurement table that I have struck with the various ministers from those provinces. But I will say that there is much work to be done on essential services and PPE for essential services. And it's important to remember that the federal government is not the only purchaser of PPE in the country. Hospitals are procuring PPE, individual businesses are procuring PPE, and healthcare centers themselves are procuring PPE. So this is an ongoing conversation, but it's important to remember that there are a number of purchasers in the country. And the most important point to remember is that the global environment is incredibly strained. The demand is high. And so the federal government is taking a very collaborative and cooperative approach with the provinces and territories in trying to determine the best way forward on these important questions.
Thank you, Minister. Ceci met fin à la conférence de presse pour aujourd'hui. Merci.